maternity. And yet their pay trickles in slowly by slowly. And when it comes in, it's deducted, but the remissions are not made. So let's regularize these things so that we also do the right thing.
Chairman, that is what the new policy is going to address. Because you are engaging them not as casuals anymore. The word casuals will no longer be used in Kitui County. We are calling them temporary workers. And conceptually, the temporary workers are more or less people on contract terms. If it's 3 months contract term, and if you are being employed as a clinical officer or as a nurse on temporary terms, the pay should more or less mirror the other ones who are working permanent and pensionable because you're doing similar work. So this is what we came up to cure this. And I can tell you, perhaps this is the only one in the Republic of Kenya. And it's because we looked at this problem, we realized it's big, and as Chair indicated, misused. And we said we have to come up with a solution and worked with the County Public Service Board. So what will be happening, the chief officers will, or the MedSups will be initiating a request to employ temporary workers. And then that request it goes to the County Public Service Board, because it's only the County Public Service Board which is allowed to recruit, even sweepers. So they will then advertise, and then they will recruit and give them proper contracts for 3 months or 1 year.
Governor, I hope your chief officers and your ministers are listening to what you are saying. That it is only the County Public Service Board that has authority to recruit. This thing of people calling their friends, you know, those things should never happen. And when are you rolling out this policy? When are you rolling it out?
Actually, we completed it. It came to the County Executive Committee. We approved it. It has gone to the County Assembly. We have members of the County Assembly here. I don't know whether they want to comment anything about it. But what I know is the last time I spoke to the Speaker early this year, he indicated some of the things which are waiting to be addressed by them, including that one, will be addressed very soon. Thank you.
Okay. That sounds progressive. I mean, if it happens, I personally would be happy to be associated with that kind of thing. But we stop this thing of people just being plucked from all over and being misused as casuals. I think.
Let me hear from legal officer.
Actually, Chair, without belaboring the point, the issue of casuals is actually clearly provided for in the Employment Act, and a casual employee has been defined as a person whose terms of engagement provide for his payment at the end of the day, and who is not engaged for a period longer than 24 hours at a time. The same Act also has regulations that require that casuals are paid at the end of every day, and the same Act under Section 37 also provides for circumstances where you can convert casual employment to term contract and the conditions that provide for such conversion. So any person who is being engaged for a longer period than that cannot be referred to as a casual.
So the 3 months is not a casual.
That is not a casual, yes.
It should be?
That is a contractual employee, yes, a contractual person, yes.
We are in agreement, because ours is temporary workers, and 3 months, and we have said we give them a contract, very clear, and the proper terms of that contract. If you're a clinical officer, if you're a medical doctor employed on those terms, or even 1 year. So we are in agreement. And we've looked at the Employment Act CAP, which was enacted in 2007.
Yeah, because this is important for us in Kitui. So, in that policy, and I would be actually happy to look at it, in that policy, is it stated that that term of engagement is renewable? Can it be renewed?
Yes, but it will lapse after that 1 year, because you are given a contract of 1 year, and then the employer, if if the hospitals themselves they request again, then it will be taken through the same process. Because again, if you create some kind of loose end at the so-called renewal point, where it doesn't go back to the County Public Service Board, once again it can be abused.
Yeah, I'm asking that because then this loose arrangement that happens all over, is that you are brought in as casual. Now we know casual beyond a day is not casual, it's something else. So you're brought in, you work for 2-3 months, then you're told go away for a week, and then come again and sign another casual for another 3 months, and 10 years down the line, you are this casual who never gets employed. So I'm wondering, in that policy, does it state clearly that if I have served my 1 year and my services are still required, can a process be initiated before the expiry of the 1 year for me to continue for a longer period?
Yes. The users, which are the hospitals, they should be able to make an assessment of those who are engaged on temporary basis when it's about a month or even 2 months before the expiry of this 1 year. Then you initiate a process of them being retained beyond the end of the term.
Okay. Honorable members, let's make progress on this. Quickly, just comment. There are two very important queries, honorable members. The first one is failure to retain facility improvement funds at the hospitals. And this one is cross-cutting. For example, in Kitui Referral Hospital, 246 million was transferred to the CRF. In Ikanga, about 6.7 million was also transferred to CRF. And the same applies to Mwingi Level 4, where 76 million was also transferred to CRF, contrary to Section 5.1 of the FIF Act. Governor, just explain this.
The FIF Act requires all the monies, revenues generated in hospital should be retained for the purposes of running the hospital. During the transition period, because the audit covered the period when we were transitioning from what was applying before, where all the monies are collected and swept to the county revenue fund. During the transition period, you'll find some monies were swept. But after that, we even discussed it at the cabinet, all the monies which the hospitals generate are retained in that particular hospitals. But of course, they prepare budgets normally, and the expenditure must be in accordance to guidelines provided in the Public Finance Management Act. But let me invite CCM Health to give us an overview of how it is functioning, whether what I've said is a correct position or it's different.
Yeah, thank you, Chair. What you're saying, Your Excellency, is true. And this question relates to that period. The implementation of FIF Act started in May. It started in May. That was last year. Before that, what was happening in the mini budget, when we were preparing the ministry's mini budget, we would allocate money for the hospitals. Then is this money from the budget that will be transferred to the hospitals through an AIE. They spend for that month, they account for it, then they request for another AIE the other month. But now when FIF started, the hospital started retaining their money. So this different, or the 420 is actually what the hospital collected, but in accrual. But what was transferred to the county revenue is the 246, because we had not started implementing FIF, and therefore at that period, the hospitals were not retaining the money. That's where the difference comes in. But currently, the hospitals are retaining the money. We have started implementing FIF. Thank you, Chair.
Let me hear from the auditor about this query.
Thank you, Chair. So what was happening in Kitui for the 10 months that you were auditing? That is in the month of July, August, September, October, November, December, January, February, March, and April of the year 2024-2025, most of the hospitals were swiping the money to the CRF. But in the month of May and June, this is when they implemented the FIF Act. Now I can confirm that the hospitals are retaining their money. But before then, for 10 months, that's why we raised this query in our audit report, because even they have included this amount in their financial statement on the total amount that they were swiping to CRF. But currently, yes, the hospitals are retaining their money. Thank you.
So you want to confirm there was no loss of funds in that process?
No, there was no loss of fund, because even in some hospitals, the county was after now the hospitals swipe the money to CRF, they were transferring actually more than what the hospital had collected. I think in the case of Mutomo, is it Mutomo? Yeah, in the case of Mutomo, where they transferred even more than what the hospital had swiped. Thank you, Chair.
Any comment on that? I think that was straightforward. Unless if a member wants to say something. The other very important query, honorable members, is the issue of expiry of medical supplies and stockouts of medical supply. And this affects all the hospitals. The issue of expired medical supplies is very prominent in the report for Kitui County, Ifaro, Kanga, the Ikuru, and Mwingi Level 4 Hospital. So,
Yeah.
Governor.
Chair, agreed, and I will request the Chief Officer for Drugs and Medical Supplies to read the response you have given, or just to explain. Just explain why is this and what is being done to eliminate it.
Through the chair, let me start with the expiries. Then I come to the last, the second question. First thing, when we came in 2022, actually during the COVID, the county received a lot of donations, and there were no guidelines on how to receive. So the first thing we did was to do guidelines on receiving. And we said, we are not going to receive a short. Some of the products were coming with like 1 month. So when you look at what is expired, most of the products are the ones which are donated between 2020 and 2021. So for that, we advertised in the June. First of all, we mocked them. We are guided by the section 163(1) on how to go about it. We mocked all the expiries from all the hospitals, including the dispensaries. And we advertised in the month of June, but it was non-responsive. But Chair, just to, we advertised it again in January, and the process of evaluation is ongoing so that we can dispose those products. Just to mention, the process is also guided by the CAP 244, that is Farmers and Person Board Act. You aggregate, then you do all the other things. Then when you get somebody to come and do, there is a way, the way drugs are supposed to be disposed, through incineration, the others which you bury, the whatever. So we are in that process, and we are going to complete that process before 15th of, the procurement process before 15th of next month. So in terms of the stocking of the hospitals, the buying of the drugs is guided by several things. Number one, it is guided by the formulary, which is established by the Minister of Health. That is essential. At the Farmers and Persons Board, Chair, there are more than 14,000 registered products, but we cannot buy all of them. So we make sure that we buy all the products for which every ailment. So some instances you might find one product is missing, but I can confirm, Your Excellency, and the Chair, that Kitui County is one of the counties where our hospitals have the essential health products and technologies. Thank you so much.
Do you have an incinerator in these hospitals, Governor? Working incinerator in these hospitals?
CO drugs? We have incinerators.
Yes, we have incinerators. We got donation from the national government for 2 of them. One at through the old bank, one at KCRH, and another one at Kawi level 4. Now, the one which has been installed is at Kawi, and we will use it. It's in the process of being installed, and once it is installed completely and we put the power, we'll be incinerating our drugs there, the expired drugs.
So you are confirming that it is not in use?
Yes, we are.
So
it is already it is installed. So we are in the tail end so that we can use it. So the process of installing an incinerator, there are several stages, which and then even it has to be tested, the people of the Farmers and Persons Board, but we are almost, before the end of the year, we'll be using it.
Are you trying to confirm that this query is there because you don't have a working incinerator?
Even before that, let me say this, even before mopping all across the county, the hospitals themselves, they have contracts on how they incinerate. There are several things which are incinerated in the hospital. Apart from the drugs, there is a contract with some people where they take these products when they expire. There are other things which are the doctors can confirm, like when you amputate and all those other things. So we have contracts at the hospital levels.
Senator Kio?
Thank you, Chair. I'm seated here, CEO. I'm seated here, so there are things you say that definitely will elicit some reaction from me. One, when you say that Kitui County is one of the counties with the best facilities and equipment, the query we are dealing with here is an audit query on drugs, expired drugs. And your explanation is that we don't have an incinerator, but in the future we will have it. So alluding to a fact that because that incinerator has not been used, then there has been an accumulation of expired drugs. Chief Officer, is one thing that we must always be truthful to, that the people that are listening to us speaking are the consumers of these services. I can sit here and say the people of Kitui don't have drugs, but if they have drugs, they know they have drugs in their hospitals. We can sit here and say they have drugs, but if they don't have, they don't have. The truth of the matter is that there is a serious stock out of drugs in the hospital pharmacies. That's a fact. We can argue about it, but that's a fact. Secondly, why would you have so much pileup of expired drugs when there are people in areas that don't have access to medical services? And I know you have an outreach program, right? You have an outreach program from the Kitui main hospital. Why not reactivate, make this outreach program even more regular, so that you can dispense maybe those drugs that may be 3 months to expiry or 2 months to expiry, and help people who really need that medical care.
On the expiries, actually when we mopped up all the expiries, most of those expiries had expired between 2020 and 2021. The major, actually around 95% of that.
When did you do the mop up? When did you do the mop up?
You know, when you mop up.
No, when did you do this mop up that brought the result that most of those drugs that expired in 2020, 2021?
We did the mop up in the month of May.
May of last year?
Last year.
So drugs that had expired in 2020, 2021 was still in our pharmacies? Is that what you're saying?
In fact, the last mop-up had been done in 2017, and that is the truth. So,
Governor, are you listening to what the chief officer is saying? Am I hearing my own things?
Okay.
I think we need to correct.
Yes, please.
Whether the expired drugs are in the pharmacies,
yes,
on the shelves,
yes,
or in some store.
yes, yes.
Okay. They are not, I think, displayed in pharmacies where they could by mistake be dispensed. Yeah.
Okay.
I think they are in a store.
All right.
And he's using a word, when you mop up, that is when you collect from all the 326 health facilities in Kitui, the expired drugs, you put them in a store.
Yes.
For purposes of incinerating them. And he also talked about an arrangement which they have put in place where they have contracted some people who can help in incineration.
I think this query, Governor, is a recurring query, and it's one of the queries we want you to take keen interest so that it is resolved, because we have had it for the last 3 sessions coming up every year. And you can hear that the chief officer is saying that the incinerator is not working. So that means that probably that's where the problem is. Yeah, so I think we need to have keen interest in that and get that matter resolved. Senator Mbugua?
Just a quick one, Chair. The value of these expired drugs, are you able to determine them? Because in the inventories you had 112 million. What is the value of the drugs which now you determined to have expired?
Okay, I can confirm. I know the cases. When the guideline gives you in terms of the cases, but we also did the evaluation, which Chair, I can give you the evaluation. I can get, because we have already a file for that. I can give the evaluation in a moment.
Chief Officer,
Yes.
just for my interest, are you a medic?
No, I'm not a medic.
The CEC Health, are you a medic?
No, I'm not a medic.
Governor, that's where the problem is.
Because
you know,
I think you should have asked further what is their training, because their training is in the health sector. They are not. They did not go to medical school, but we have the med-soups. All the med-soups who talked here are medics, and these are not necessarily people who will be in the ward.
Not that I'm saying.
Even the gentleman who was talking is only, he gave a very short answer. He should say why he was found suitable to deal with the drugs and medical supplies. What experience does he have? Can you explain?
Through the chair, we have the experience for the last 25 years. That is the job I've done. In the healthcare, there is no other place I've worked, and not only in the healthcare, in the formulation.
This job that you have done, Chief Officer, you know.
Okay, that is what I'm coming.
Okay, okay.
And in the management of the drugs. My first degree is a degree in biochemist, and my second degree is an MBA. So you just need that management to manage that that bit of the you can manage drugs when you have that. And already I have a very big team, which helps me to run. You don't have to be a doctor to buy and manage drugs.
So if you have done biochemistry, 25 years in the drug industry, really you have the necessary experience to do this kind of job. Deal with the meds, deal with the KEMSA, deal with the supplies, and you don't have to be a pharmacist to do it. To be a minister, you don't have to be a medical doctor. Take, for example, Nairobi Hospital. Take all these video ones. Who are the people at the helm? The wards, you have doctors there, yes. So, and that's where, as Kenyans, sometimes we get it wrong. We give management drug to technical people, or vice versa. Thank you.
I really don't want to remind this committee that Nairobi Hospital, when it recorded the best performers, the CEO was Milo, and an aligned Milo, and he is not a medical doctor.
I don't want to open that debate. I don't want to open the debate now. So, honorable members, I think we are done with the cross-cutting issues, but there are two important issues in the report for the Uhuru, which I want comments from the government. The first one is unutilized medical equipment, the equipment that was given to you for ultrasound machine by USAID that has remained idle for all these years. Governor, can you comment on that?
Yes, MedSoup Sikru. I know now it could be news, but let me hear why so many years, although you may have activated this recently.
Thank you. Through the chair. First, I would like to confirm that it's true we have an ultrasound machine at the facility that was donated in the year 2020 by USAID. That is, okay, now the current status is, well, first, sorry, I'll start with why it's not in use in the first place, then I'll give the status report. So in the years after 2020, we did not have a radiology block that houses the ultrasound machine, including the staffing and the x-ray. In the last financial years when we got the radiology block done, it's currently in use and the x-ray machine has been installed in the ultrasound machine. What the status report is that we are waiting recruitment for sonographers and radiographers to be able to utilize the machines, and that recruitment has already been advertised. As we have attached an advertisement for the Kitui County government that is currently underway to recruit more than 200 staff, including radiographers that will be deployed to the hospitals. Thank you.
Comments on that response?
Thank you, Chair. It is true. It is true that the recruitment process has started, but up and until when the machine will start working, the issue is still to us. The issue is still not addressed. Thank you, Chair.
Yes, Governor, what is your response? You have been given a good machine,
Yeah.
which is lying idle, as per the auditor.
Yes, the auditor is correct, and as Medsup has indicated, we have initiated the necessary process to make sure it's in use. You can see here it's more of the personnel, because ultrasound machines, you can't just everybody operating them. So that is being done. And maybe I'll ask the Medsup, his estimate when this same machine be utilized, when can we have the personnel and so forth, because I think it's good to get an indication.
Thank you. As the recruitment is ongoing, we're giving it around 2 months to do the interviews, and once employed with the County Public Service Board, then they'll be deployed to the Minister of Health. And we have done a letter to that effect to the Chief Officer to request for more staffing as part of the recruitment that is ongoing. Thank you.
Okay, honorable members, I don't think we'll put this for debate because they have said that they need 2 months to have this. By the way, Governor, after 31st of March, we will now start coming to counties to do inspection tours, and maybe this is one of the places we'll come to. So that will be verified very soon. The last issue, Governor, still on the Ikuru, was lack of a hospital management board. That this hospital for the last 11 months has not had a board, and even the financial statements were not approved by the board and signed by the board. What is the current situation? And then also you can comment about the other hospitals. Do they have boards as well?
Let me request the CCM Health and Sanitation to talk to that point. I can add something afterwards.
Yeah, thank you, Chair. It's true that the Sikuru's board was not in operation during that time, and they indicated why the auditor's report was not signed is that the chairman was not around. They have, however, corrected that, and the board are meeting. Chair, I want to state that the board's period has expired, and we are in the process of ensuring that we bring others on board so that they can serve in the hospitals. Thank you.
In the process, but in your written response, you said that you gazetted a board in May 2025.
Yeah.
So which one is which?
Yeah, Chair, that was gazetted because their period had expired, and we were hoping to bring another board, hospital board and health centers and dispensaries committees within 3 months. So that period had been renewed just for 3 months as we were bringing the other board. This was based on the Kitui County FIF bill that we had prepared. So we were hoping the bill will be passed, it will become an act, and then we use it to have the boards. But that did not happen as we had expected. So the period expired in August.
See, whatever you are telling us orally is not in tandem with your written response. So, because you have even attached minutes of the board meetings that are being indicated that they meet on quarterly basis.
Yeah, I can clarify that, Chair, if you allow me. The board's period has expired, but they are still working. That's where the problem is. But we are in the process of bringing others on board.
Auditor, let me hear from the auditor first.
So whatever she's saying is even irregular. Because the term expired and they are still paying them, then that is irregular. And I don't know, because that is not allowed. So when we go, at least now we have an audit query for 2025, 2026.
You know, Chair, Waziri Koke, you know, and that's why I encourage people when they appear before the committees, just stick to the query, just stick to the audit query. Don't say so many things. By saying so many things, you expose yourself to a lot of trouble. Now, that's not even an irregularity, it's an illegality. How can you have a board sitting when its term has expired? And you see now when you say those things, now some people say, oh, the senators are harassing us. I mean, surely, how can you even say that? How can a board be sitting past their term? What does that mean? Does that mean that in Kitui then it doesn't matter whether you have a letter or you don't have a letter, you can just walk in an office, governor, and work? For as long as you one day you walked in and worked, you continue getting in and working. I mean, what really?
We all agree that should not be the case. But there's something which CCMA and sanitation has said. We passed a bill at the executive side, FIF Act, and within it, there are provisions of how to appoint boards for all our 326 facilities, including the hospitals. That particular act has not been dispensed with at the county assembly, but it had been hoped previously that it would have been done, and we will not have a case of a board which was there before, and now, because we have hospitals which have grown and we need different caliber of people, and we can't change them. But we agree, once the term has expired, they should not be allowed to sit. Yeah, thank you, Chair.
Very well.
So do we rely on your report, on your response to do our final report? Because your response, Governor, it says that the Hospital Management Board currently meets on a quarterly basis to achieve the facility's strategic goals, and even refers us to an attachment. So do we rely on this report as a response to do our final report?
Yeah, what we are saying, that response reflects an arrangement which should not be applied, Mr. Chair.
So the response should read, actually, they meet on quarterly basis illegally. Anyway, Governor, I think this one we need to regularize, otherwise it's going to become an audit query in 2026, 2027.
It's already a query.
It's already a query, so someone will have to be surcharged. I don't know who it is for this. So, honorable members, I think that brings us to the end. We are about 15 minutes to the plenary time. Let me just allow the Senator for Kitui to make final comments and the Governor.
Thank you, Chair. I will just say one thing for our remarks. As Senators, we appreciate the presence of the Governor of Kitui before the Senate Public Investments Committee. We are glad that you have chosen, as I said from the beginning, to do the right thing, to confront issues, deal with them, follow the law. As for those colleagues who are not here, we will deal with them in a manner that befits their status. I thank you.
Sorry, I made a mistake. I should have allowed the MCAs, particularly one MCA, your chair, to say something very briefly. Sorry, Deputy Minority Leader.
The guy who wants to speak is actually my MCA, so that's why. He speaks for me in a lot of things, so he can speak here.
Thank you, Chairman. Indeed, it has been a good experience working in the Senate Committee on Public Investments and Accounts. And as the matters were being addressed here, I want to clarify on one matter before we adjourn. I want to confirm to this committee that the incinerator in question in Kawi Ward is functional, is working. I attended the testing. We did some tests, and it is functional. Chair, as a committee, we undertake to complete our pending business within the time that we've been given by the Constitution. So we have drafted letters for invitation, awaiting for the committal of the reports at the Assembly, possibly today or tomorrow, because we received from our recess. I want to thank our governor for attending this session, because yesterday there were fireworks at Kilifi, where senators, where the governors were requesting governors not to attend park and peak sittings. But I personally take it as this is actually a responsibility to be oversight when you have been put in charge of the public funds. So we hail our governor, we thank our governor for choosing to attend this meeting. Thank you, Chair.
Governor, is your time.
Governor, by just that appearance, you have put our county in a very good position. The national map. Now we'll be trending in a good way.
Governor, is your time, and maybe as you talk, you can confirm or deny whether you have been intimidated or harassed.
Chair, first of all, let me thank you and the members of Senate and the other institutions represented here, including the auditors. Always, when we appear before the Senate, my experience is we always learn things, particularly how to improve in areas where we have gaps. And as I indicated initially, I received an invitation to come together with the officers who are relevant to deal with the issues which have been raised by the auditor. And I confirmed in writing that I will come, and I came. In terms of intimidation by anyone, as you know, our senator knows what they call me back home. So nobody has harassed me. Thank you. Thank you, for really doing what I've done, because we must be accountable. They are not always about it.
Chair, you forgot to do one thing. Now that we have spent time, they just spent no problem. You forgot to do one thing. You forgot to recognize that the county executive of Kitui, especially for this purpose, they have more ladies in senior positions appearing to respond to audit queries than men. Chair, if that was your county, you would have been clapping. Can you please lead us to clap for this?
Actually, Chair, I mentioned to him that I didn't know that Kitui, you know, the way Kitui is, sometimes we thought it was a remote like some counties. But when I heard the names, especially the ladies and even the young, you even say Guru is a very young doctor. So congratulations. the great people of
You
Kitui.
mentioned to me in whispers. Now can you say it? So
Yeah. That's what I'm saying. That's why my daughter has married from Mugabari. My son.
Thank you very much, Governor, for honoring our invitation. Indeed, this is a great honor. And even as we go to the Senate plenary, you will come out as one of those governors who understand that accountability is not a favor, but is a constitutional requirement. So I want to thank you for that. I know we have other reports which we have not, the reports on funds and the additional hospitals. That we will have another sitting soon to also process. And so when you are invited, I hope you will not join the bandwagon that is saying that this committee is inviting them so many times. Governor, you've seen how we have struggled with the 5 reports in one sitting. We have just been dealing with cross-cutting issues. So you can imagine if we were to do 11 reports in one sitting, how that quality of work will be very poor. So we hope to also get a moment where we'll come to the ground to look at how these things are working on the ground. And we wish you well as you travel back to Kitui. Thank you very much. Honorable members, the meeting is adjourned. Thank you, Chair.
Thank you.